Hi, this is Eric Motz, and welcome to my presentation of Change Management Success for Healthcare. Healthcare organizations are continuously required to change, and here is some of the driving factors. Updated evidence-based practices, such as a new protocol, an improved protocol for weaning patients off of a ventilator in the ICU. New regulatory or accreditation standards, such as HIPAA. Changing population needs, such as an increased ratio of diabetic and obese patients in the community. Pushes for patient-centered care, such as delivering value-based care that benefits the patient and focuses and revolves around the patient rather than the organization, the provider. Public health crises such as COVID-19 drastically changed the way hospitals and healthcare organizations needed to do things very quickly. The point is, change is a characteristic of the healthcare environment. It should be anticipated as a daily reality and not as a surprise or an interruption. Next slide. The problem with change management is that 70% of change efforts fail. Why? Poor planning, lack of competence in applying change theory. In other words, healthcare organizations just try to make it up as they go rather than referring to proven models. Incompatible work cultures that are not change ready. These are really poor work cultures, and some of the characteristics are poor psychological safety, which means people don't feel safe to share their ideas and collaborate, communicate with leadership, unsupportive leadership, those who don't respect or listen to their employees, who also will not collaborate with them, and this lack of psychological safety and unsupportive leadership sets up an environment where there's little collaboration and staff feels that they're not provided the resources they need to accomplish the goals they're given or desire to achieve. And the result of all this is staff resistance. And why would staff not resist when they know that their leaders are poor planners who don't support them and don't provide the resources they need and don't respect them? It's a natural outcome. Next slide. My proposed solution to ensure successful change management efforts. It's two parts: improve staff competence and the health of the organizational culture. Now, when we're talking about competence, we're talking about competence in applying change management and quality improvement theories, which is associated with successful efforts, and creating a healthy organizational culture that is more change ready. The characteristics of a healthy organizational culture are supportive leaders who collaborate with staff, open communication, transparency and teamwork, early and frequent communication about coming changes. Research shows that staff is more change ready when there is early and frequent communication. So really what we find is that change management is strategic. It's the framework of an organization. It shouldn't be treated as episodic. And the reason why many of these efforts fail is because they are treated as episodic. It's just something that's shoehorned into operations rather than being a part of the culture and competence of the organization. So creating competence in change theory and quality improvement and a healthy organizational culture are the framework for success. Next slide. So what is the implementation plan for improving change management? It's to create competence in change management and quality improvement theories through training and to develop the culture. So competence in these theories is reinforced strategically. In other words, we want it to be long-term, ongoing, built into the organization, and the way that is done is by incorporating the training into annual continuing education, by starting off new employees with training in it, and by reinforcing it and performance reviews with employees, having their reviews reflect their participation in change management and their acceptance. So besides competence, we want to develop the culture, and again, that's more training. So we're going to train leaders to be more supportive and collaborate with staff, train all staff in respectful communication and teamwork, and align the efforts with the mission and promote it. So it's really all about teamwork and communication. Change management is overwhelming to any one individual, but when people feel like someone has their back and they can work together to get something done, it's not as intimidating. And so that's why we need to develop that kind of culture, and we need to monitor attitudes. People need to be surveyed to find out how they feel about change management and the training. We need to respond to that feedback by making improvements to the way the training goes. And this is all in alignment with quality improvement. This is how you do quality improvement. You elicit feedback and you make iterative improvements, and even the implementation of the program is not immune from that improvement. Next slide. So next we're going to talk about the timeline for the implementation, and that begins with the pre-implementation, which is the planning and obtaining approvals and funding. 12 weeks should be a good amount of time to do this, and it begins with creating a process map. And on this process map, at the beginning of the process map, we're going to have the problem, which is failed change management efforts, and it will end with the desired outcome, which is successful change management efforts, and I would add a healthier organizational culture, which will help support those efforts. Then we're going to map out the evidence-based processes and resources in the middle of the problem and the desired outcome, and that will help define the people and resources and processes needed to achieve that outcome, and then we can more accurately define who will need to do what in the implementation and ongoing support of the initiative. Once we have the processes defined, we want to create some metrics, which are quantitative and qualitative measures of performance. How are we going to determine whether the implementation and ongoing initiative is successful? Next, these solutions need to be presented to senior administration and the Board of Administrators to obtain approvals and funding. Without this step, there's no need to go any further because somebody needs to pay for this and authorize it. Next slide. The next step in the implementation is to create an implementation team, which should take about 16 weeks. It says concurrent on the slide because there will be 2 more slides that have 16 weeks on them, and all of these steps would be somewhat concurrent. So on that implementation team, we need a site champion, someone to spearhead and direct the initiative. So in this instance, it would be a quality improvement professional, most likely, since that person should be the expert on these principles and could conduct the research to develop the curriculum and help develop the policies that will support everything. Senior administrators need to be part of the team to provide strategic management, resource allocation, and to endorse the initiative. And what I mean by endorse is they need to openly represent and promote the initiative as an organizational priority. Department managers, they'll need to schedule training in between operations. They need to find people on their staff that can act as champions to help promote the initiative, and of course, like the leaders, represent the initiative as an organizational priority and garner staff support by supporting it and believing in it themselves. Many support departments will be needed to be part of the team. There should be a representative from HR and finance and information technology, facilities management, and there will need to be data analysis. So these departments will need to have representatives on the implementation team. Of course, frontline workers will need to be part of the team, perhaps the most critical part of the team, because they need to buy into the initiative and embrace it so they can promote it with their peers. And also they're the ones doing the frontline work, and they need to provide feedback about integrating changes into their workflows. Next slide. So the next part of the implementation plan is to design an internal communication plan which runs concurrent with the previous step. And research shows that change communication enhances staff change readiness. Some high quality ways to do this are to have signs around the hospital promoting the initiative, and to have a dedicated website where staff can go and browse information, and as well as a dedicated newsletter. One thing that has been found to be crucial for change management success is informal communication, in-person conversations between managers and staff and champions and their peers. Next slide. The next part of the implementation plan, which runs concurrent with the others, is to promote the plan and its expected benefits to the community. This can be done through a newsletter and emails to patients, local providers, and the media. And the messaging should suit their desires that the plan will help the hospital to be more effective in achieving its mission, serving the community, and delivering friendly, higher quality care. Now, regulators, lenders, and vendors, they will need to be communicated with messages that are appropriate to their role from appropriate staff. In other words, for instance, like the finance department would talk to lenders, etc. These are not necessarily going to receive a newsletter about how it will help the hospital to serve the community, because their interests would be financial and they need to talk to an appropriate person with a tailored message and communication. Next slide. So finally we get to the actual implementation of the program, and that mainly consists of training. Feedback and improvement are integrated into it as part of that quality improvement cycle, and it's going to take 6 months because it has to accommodate busy clinicians and operational concerns, people on different shifts with different schedules. And again, the focus of that training would be evidence-based change management and quality improvement models, teamwork and communication, and leadership. And this would consist of online elements, in-person teaching, teamwork workshops. It's important to have different ways to learn for different types of learners. Some are visual, some are audio, some need to interact. This of course provides multiple sources of reinforcement, perhaps an online element to get people familiar with the material, and then they have an in-person class. And again, we want to have feedback opportunities with the instructors and online surveys to elicit feedback from employees about the quality of the training so that improvements can be made. Now, this training would be incorporated long-term into the continuous education aspect and new employee training, so we're addressing that strategic element as we go through the first round of the implementation. Next slide. Evaluation or monitoring. First, we want to measure the effectiveness of the initial training implementation, and quantitatively, staff would be tested after they receive their model training, and they would have to receive a passing score to progress. Also, participation would be mandatory, so that's part of it. Qualitatively, staff would be surveyed on their impression of their change readiness and how confident they feel with applying the models that they've learned. And all of this feedback could be used to try to improve the program. So next we want to measure the organizational culture impact, and that would be both initial with the implementation and long term. So that would be through staff surveys on how they feel about the quality of leadership support, communication, teamwork, and communication about changes. And then in the long term, what we really want to know is there a higher ratio of successful change initiatives? If there was a 50% failure rate before, is it now 35%? So, just generally, is the organization more successful in conducting change initiatives? Next slide. So next we address the dissemination plan, and what we want to do with that is communicate the evidence-based nature of the initiative and report on its outcomes. Internally, some of the main stakeholders are the board of directors, and the message to them should address how the plan serves the community, since the board of directors is usually has a mix of community members who are representing the community. Doctors, nurses, and clinical staff, they are interested in evidence-based justification and patient benefits, so that should be the messaging to them. Again, frontline staff, they need early and frequent communication to be change ready, and clinical staff are also particularly interested in evidence-based justification. It's harder to argue against changes that are more effective and are proven through research to be more effective. Of course, if the changes are poorly implemented, that's always an argument against something, so that's what we're trying to avoid with this initiative. And reporting on the success of the initiative, short-term wins, gives it momentum. It improves morale, and it aligns with Kotter's change model, which is providing short-term wins. How to report these things: through department meetings, organizational meetings, emails, and the dedicated newsletter mentioned earlier. Next slide. Now we talk about the external dissemination plan, and some of the stakeholders are lenders and supporters. We want to justify the validity of the plan and the return on investment for financial institutions. And how would we do that? Through meetings, emails, and phone calls with appropriate staff. As mentioned earlier, those type of stakeholders would have specific point people within the organization that they would interact with. And we want to communicate the outcomes of the initiative to the community and patients. It demonstrates the organization is striving to improve its services, which can build pride, confidence, and positive word of mouth about the hospital. On the contrary, nothing brings down the reputation of a hospital like people talking about how they just don't care. This demonstrates that the hospital is trying to improve itself, which is a good thing. And how would we do that? Through newsletters, perhaps mailers to the community in general, emails to those whom we have the email address, such as patients, media promotion, interviews perhaps, on the radio, or even commercials on TV. The outcomes could be disseminated to professional organizations and journals. to provide valuable information for research or articles. And how do we do that? By submitting research articles or networking with peers. Next slide. In conclusion, change management is a continuous requirement in healthcare. Never stops. Managing it properly is a strategic effort. It is not episodic. Most change management efforts fail, and we've discussed some of the reasons why. Successful examples show us how to do it right. Apply change management and quality improvement principles and develop a healthy organizational culture. This initiative addresses those crucial aspects. It is a significant investment to perform change management properly and to build the organizational culture, but failed efforts are wasteful and demoralizing. And besides change management, improving the culture and competency has benefits that extend beyond change management, improving the organization comprehensively. That concludes the presentation. Thank you.